Welcome to Learn English for Life.
Good morning. How can I help you today?
Good morning, doctor. I have been having some stomach pain for the past few days, and I'm starting to get worried.
I'm sorry to hear that. Let's try to get to the bottom of it. Can you describe the pain for me? Is it sharp, dull, cramping, or burning?
It's mostly a dull pain, but sometimes it feels more like a cramp. It comes and goes throughout the day.
I see. Can you point to where exactly it hurts?
It's mostly around the middle of my abdomen, just above my belly button.
And how long have you been experiencing this pain?
It started about 3 days ago.
Have you noticed if anything specific triggers the pain, such as eating certain foods or doing certain activities?
It seems to get worse after I eat, especially if I eat a large meal.
Have you had any changes in your bowel movements, such as diarrhea or constipation?
Yes, I have been a bit constipated lately.
Any other symptoms? Nausea, vomiting, fever, or bloating?
I feel a bit nauseous sometimes, but no vomiting or fever. I do feel bloated quite often.
Have you been under any unusual stress recently or had any significant changes in your lifestyle?
Yes, work has been really stressful lately, and I have not been eating as well as I should. I have been eating a lot of fast food.
Stress and diet can definitely contribute to stomach pain. Do you have any known medical conditions like ulcers, GERD, or irritable bowel syndrome?
I was diagnosed with GERD a couple of years ago, but it has not bothered me much until now.
GERD can certainly cause the kind of pain you're describing. Have you been taking any medications for it?
I used to take omeprazole, but I stopped a few months ago.
Sometimes stopping medication can cause symptoms to flare up again. Have you been taking any over-the-counter pain relievers like ibuprofen or aspirin?
Yes, I have been taking ibuprofen for some headaches.
It would be a good idea to avoid it for now. I can prescribe you a different medication to manage your headaches that won't irritate your stomach. In the meantime, let's also get you back on a proton pump inhibitor like omeprazole to help with your GERD.
Oh, I did not know that. I should probably stop taking it then.
Definitely. Try to eat smaller, more frequent meals instead of large ones. Avoid spicy, fatty, and acidic foods, as well as caffeine and alcohol. Make sure you stay hydrated and get plenty of rest. Reducing stress through relaxation techniques or regular exercise can also help.
Okay, I can try that. How long do you think it will take before I start feeling better?
You should start to notice some improvement within a few days of making these changes and starting the medication. If the pain does not improve or gets worse, please come back to see me. We might need to do some tests, like blood work or an abdominal ultrasound, to rule out other causes.
I will do that. Thank you so much for your help, doctor.
You are welcome. Take care and don't hesitate to reach out if you have any concerns or if your symptoms persist.
Thanks, doctor. One more thing. If the medication does not work, what other tests might you recommend?
If the medication does not help, there are several other tests we can consider. We might start with a blood test to check for infections or inflammation. An abdominal ultrasound could help us see if there's anything unusual with your organs. If necessary, we might do an endoscopy to take a closer look at your stomach and esophagus.
An endoscopy sounds a bit scary. What's involved in that?
It can seem daunting, but it's generally a safe and straightforward procedure. You will be sedated, so you would not feel any pain. We use a thin, flexible tube with a camera to look inside your digestive tract. It helps us identify any issues like ulcers or inflammation.
That sounds more manageable. I will keep it in mind if it comes to that. Is there anything specific I should avoid doing in the meantime?
Yes, aside from avoiding ibuprofen and other NSAIDs, try to avoid lying down immediately after eating. Wait at least 2 to 3 hours before going to bed. Elevate the head of your bed to reduce nighttime symptoms. Also, avoid smoking if you do, as it can worsen GERD symptoms.
Got it. I don't smoke, so at least I don't have to worry about that.
That's good to hear. Smoking can have many negative effects on your health. Are you managing to get enough sleep despite the stress from work?
Not really. I have been sleeping poorly, maybe around 5 or 6 hours a night.
Poor sleep can definitely contribute to stress and digestive issues. Try to establish a regular sleep routine and aim for 7 to 8 hours per night. Avoid screens before bed and consider relaxation techniques like reading or meditating.
I will give that a try. It's been hard to relax lately, but I know I need to make some changes.
It's understandable. Stress can be tough to manage, but small changes can make a big difference. Have you considered speaking to a counselor or therapist about your stress?
I have not, but maybe I should. It's been overwhelming, and I think talking to someone might help.
It could be very beneficial. A counselor can help you develop coping strategies for stress, which can improve both your mental and physical health.
I will look into that. Thanks for the suggestion.
You're welcome. Addressing your stress will be a key part of improving your overall health. In the meantime, keep an eye on your symptoms and follow the advice we have discussed. If anything changes or you have concerns, don't hesitate to reach out.
I will, Doctor. Thank you so much for your time and advice.
Anytime. Take care of yourself, and I hope you start feeling better soon.
Thanks again. Have a great day.
You too. Goodbye.
Hi, doctor. I'm sick.
Okay, what seems to be the problem?
My fever is really high.
It's probably because of a virus. Do you have a cough?
Yes, I do.
That's nothing unusual. Viruses cause a lot of colds and few symptoms. We all need to practice good hygiene to help prevent them.
I know, but it's really bad.
Okay, what's your temperature?
It's 102 degrees.
That's a bit high, but not really surprising. Your body is working overtime to fight off a viral infection.
I know. It's just so uncomfortable.
I can give you some medicine to make you feel better.
That's not necessary. I just need to get through the day without feeling miserable.
I understand, but you're probably going to feel better soon. You'll get your energy back in no time.
I hope so.
I'm sure you will. I'm going to give you some medicine to make you feel a little better.
Thank you.
What brings you in today?
I have a fever.
Okay, that's a pretty common complaint. Tell me, how long have you had this fever?
I don't know exactly. I think it started yesterday.
Okay, have you taken any medications to try to bring it down?
No, I have not.
Well, I would like to give you something to help you feel better. But I am concerned that you might experience side effects if I do.
I understand.
So, let's talk about this a little bit. I would like to make sure that you are comfortable with my recommendations.
That sounds good.
I think I should mention first that there is a very good chance that you are suffering from a virus. And if you have a fever, it's likely that you have caught a cold or flu. I don't think you have had a fever this high before, so I'd like to rule out infection first.
I understand.
Let's talk about your options. I'm going to give you a prescription for some over-the-counter medication. It's called acetaminophen. It's very effective at bringing fevers down. I think it's safe to take for at least 3 days.
I'm sure I can take it for 3 days.
You might have some minor side effects from taking it, but it's a small price to pay to feel better.
Okay, sounds good.
Okay. I'm going to write you a prescription for a couple of days worth of medicine. It's just to make sure that you get well.
I understand.
I'm going to have you come back in 1 week to make sure you are feeling better. If you are still sick, then I will give you a different prescription.
That sounds good.
I will see you next week.
Thank you, doctor.
Hello, Mr. Jones. How can I help you? I have been having a headache for a few days now. Are you sure it is not just a normal headache? Yes, I'm pretty sure. Well, let me take a look. Okay. Your forehead looks a little red. Do you have any allergies? I don't think so. What about sinus problems? I don't think so. Have you been sleeping well? Yeah, I have been getting about 6 hours of sleep every night. That's not an insufficient amount. Yeah, I know. Have you been feeling tired all day? Yeah, a little. How about your appetite? I'm not really hungry, but I'm not losing weight. I'm not really hungry, but I'm not losing weight. Have you been drinking enough water? Yeah, I try to drink a couple of glasses every day. That's a good idea. Yeah, I know. Let's take a look at your head. Okay, it seems like your forehead is a little swollen. Yeah, it's a bit tender. Do you have any problems with your vision? No, my eyesight is fine. Do you have any pain in your joints? I don't think so. Have you been feeling any other symptoms? No, I don't think so. I'm going to give you a prescription for some pain medication. Okay, I would like to see you again next week. Okay, thank you, doctor.
Good morning, Mrs. Smith. Why are you here today? What's wrong?
Well, actually, I haven't been feeling well these days, doctor. I feel sick.
I see. All right, then. You can tell me what's wrong.
Well, I don't know exactly what's wrong with me, but I've had fever for 5 days.
5 days of fever doesn't sound good. How did it start the first day?
I was working normally the last Monday and then I got a little dizzy while I was at the office.
It was on Monday. Okay. What did you do the day before Monday? On Sunday.
I was at home all day. Well, at night, I went to a party. It was my cousin's birthday.
And what did you eat during this party? Anything that could hurt you.
Well, they prepared a special food for that day. I think it was Thai food.
Have you had Thai food before or it was the first time you ate that?
I have eaten Thai food a lot of times before and nothing happened. I like it.
All right. Anyway, we need to check all the possible options here, you know.
Sure, doctor. But I don't think the food made me sick. I didn't feel bad.
We'll see. Did you have a stomachache that day or the next day?
That day at night, nothing happened. But the next day I woke up with a stomachache.
On a scale of 1 to 10, being 1 not any pain and 10 a lot of pain, how much did it hurt?
I suppose it was a 2 in the morning when I woke up, but it was 7 in the afternoon.
Okay. I also need to know. Did you drink any beer or any kind of alcohol at the party?
I don't drink alcohol, doctor. I haven't drunk it since I was diagnosed with fatty liver.
Oh, you have a fatty liver. When exactly were you diagnosed with that condition?
It was 2 years ago. I went to the hospital because of a pain on my stomach.
I get it. It's important to know that. Any other illness we need to know?
Well, last year I broke my leg while I was driving my car. I had an accident.
Wow. That's terrible, Mrs. Smith. I'm really sorry about that.
Thank you, doctor. But that's okay. It was not very serious. Happily.
I can see. That's why you're walking normally. I supposed it wasn't.
Yes. I had to use a cast on my leg, but just for 3 months. That was terrible.
I suppose so. Well, going back to last Sunday. Did anything else happen?
No, doctor. I think that's all. I arrived home late that day and fall asleep.
All right. What prescription and non-prescription medications do you take?
Well, I don't usually take any pills. Just some painkillers when I have any pain.
I need to know exactly what kind of painkillers do you take. It's important.
I don't remember the name of it very well, but I think it is no pain more pills.
Okay. What allergies do you have? Are you allergic to anything?
I don't think so. I have never had any problems with any food or drinks.
All right, but are you allergic to any medication? Any pills?
No, doctor. I'm not allergic to any pills or medication. I can take them all.
Great. Have you had any operation before for any reason?
No. I've never been operated for any reason. Happily. That must be horrible.
It can be, sometimes. What do you do for a living, Mrs. Smith?
I am a manager in the biggest restaurant of the city. Maybe you know that.
You mean the Tast restaurant that is in the center of the city? The Chinese one?
Yes. That one. I work there from Monday to Friday from 7 a.m. to 6 p.m.
I see. And do you eat there or you take food from your home to work?
I usually cook at home and take it to my work, but sometimes I have to eat in the restaurant.
Have you eaten the food from the restaurant these days? Before you got sick?
No. The last time I ate there was 3 weeks ago and it was a salad. Nothing fatty.
I see. Do you smoke, Mrs. Smith? If so, how often do you do it?
I don't smoke very often. Probably once or twice a month and that's it.
Do you feel pain in your throat? I mean, do you have a sore throat?
Yes. I feel a little pain on my throat. But it always happens to me.
What do you mean it always happens to you? Do you usually feel pain on the throat?
Well, I've suffered from this since I was a child or since I can remember.
I see. I can see you're sneezing, Mrs. Smith. Why is that?
It usually happens when I feel pain on my throat. I sneeze and cough a little.
Since when are you sneezing and coughing? Did it start the same day?
Yeah. To be honest. I always sneeze and cough, but just a little. It's not a big deal.
I know it doesn't seem serious, but we need to check all the options as I already told you.
Okay, doctor. But I thought it was normal since I've had this problem for years.
Well, we'll need to do some exams to see if that is the problem or there's something else.
Okay, doctor. But do you think it can be serious? I need to come back to work.
I don't recommend you to do that. You'd better go home and rest a little for today.
What? Wow. Is it that serious, then? I mean, I've been working like this.
Look, I'm not sure, but I'm afraid you could have pharyngitis. I suspect so.
Pharyngitis? What is that? I've never heard about that before.
It is inflammation of the pharynx, which is in the back of the throat. Do you understand?
Yeah, I can understand the problem of the throat, but what about the stomachache?
Well, sometimes it happens that an infection can affect other parts of the body.
Oh, God. I hope it isn't anything serious. I can't stop working.
In the worst case, we will need to operate, but it is not dangerous. Don't worry.
Okay, doctor. Then, what do I need to do now in order to get better soon?
I will give you an order to do this exam and then we'll see the results next week.
Thank you, doctor. I will wait then until the results are ready to know.
Yes. Go pass with my assistant, please. And that's it for today. Good morning, Mrs. Johnson. How are you feeling today?
Good morning, doctor. I'm feeling a bit tired, but otherwise all right.
I see. Have you been experiencing any specific symptoms lately?
Well, I have been having some persistent headaches and occasional dizziness.
I'm sorry to hear that. How long have you been experiencing these symptoms?
It's been about a month now. At first, I thought it was just stress from work, but it seems to be getting worse.
I understand. Have you noticed any triggers for these headaches or dizziness?
Not really. They seem to come and go randomly throughout the day.
All right. Have you been taking any medication for these symptoms?
No, I have not taken anything yet. I wanted to see you first before starting any medication.
That's a wise decision. I will need to perform a physical examination and possibly some tests to better understand what might be causing these symptoms. Would you be comfortable with that?
Yes, of course. Whatever it takes to figure out what's going on.
Great. Let's start with a physical examination. I will check your blood pressure, heart rate, and perform some neurological tests to assess your symptoms. Your blood pressure and heart rate seem to be within normal limits. Now, I would like to schedule some tests to further evaluate your symptoms. We will start with a blood test and a CT scan to rule out any underlying issues.
Sounds good, doctor. When can I expect to have these tests done?
We will try to schedule them as soon as possible. In the meantime, I would like you to keep track of your symptoms and any specific triggers you might notice. It will help us get a clearer picture of what's going on.
All right, I will make sure to do that. Thank you, doctor.
You are welcome, Mrs. Johnson. We will get to the bottom of this together. I will have my nurse follow up with you to schedule those tests.
Thank you, doctor. I appreciate your help.
Before you go, is there anything else you would like to discuss or any other symptoms you have been experiencing?
Thank you, doctor. I appreciate your help.
I'm glad you mentioned that. Stomach discomfort could be related to a variety of factors, including diet, stress, or underlying gastrointestinal issues. It's important for us to address this as well. Have you noticed any specific foods that seem to trigger this discomfort?
Actually, now that you mention it, I have also been having some stomach discomfort after meals. It's nothing severe, but it's been happening consistently for the past couple of weeks.
I see. We will definitely need to explore this further. I will add some additional tests to evaluate your gastrointestinal health along with the other tests we discussed earlier. It's possible that there could be a connection between your stomach discomfort and the headaches dizziness you have been experiencing.
Not really. It seems to happen regardless of what I eat. Sometimes it's just a mild feeling of bloating, and other times it's a bit more uncomfortable.
Of course, Mrs. Johnson. Your health and well-being are my top priorities. I will make sure we thoroughly investigate all of your symptoms to provide you with the best possible care.
That makes sense. Thank you for taking all of this into consideration, Doctor.
You are very welcome. Don't hesitate to reach out if you have any questions or concerns before our next appointment. In the meantime, take care and try to get some rest.
I really appreciate that, Doctor. Thank you again for your help and attention to detail.
Absolutely, Mrs. Johnson. I'm here to support you every step of the way. Remember, if you experience any worsening of your symptoms or develop new ones before our next appointment, don't hesitate to contact me or seek medical attention.
Thank you, Doctor. I will do my best. Take care as well.
That's great to hear. It's important to approach your health concerns with a thorough and systematic approach. Together, we will work towards finding the answers and getting you on the path to feeling better.
Thank you, Doctor. I will keep that in mind. I'm feeling more hopeful now that we are taking a comprehensive approach to figuring out what's going on.
You are very welcome, Mrs. Johnson. It's my privilege to be your physician. Let's stay in touch and continue this journey towards better health.
I trust your expertise, Doctor. Thank you for your dedication to helping me.
You too, Mrs. Johnson. Take care, and I will see you soon.
Agreed. Thank you once again, Doctor. Have a good day.
Good afternoon, Mrs. Johnson. How have you been since our last appointment?
Hello, Doctor. I have been doing all right, thank you. The headaches and dizziness seem to have improved slightly, but I'm still experiencing some stomach discomfort after meals.
I'm glad to hear there's been some improvement with your headaches and dizziness. Let's discuss the stomach discomfort. Have you noticed any patterns or specific foods that worsen the symptoms?
It's still a bit unpredictable, but I have noticed that heavier meals tend to trigger more discomfort. Also, I have been experiencing some acid reflux lately, especially when lying down after eating.
I see. It's possible that you're experiencing some gastrointestinal issues such as acid reflux or gastritis. These conditions can often be managed with dietary modifications and medications. I would like to prescribe a proton pump inhibitor to help reduce the acid production in your stomach and alleviate your symptoms. Additionally, I will refer you to a gastroenterologist for further evaluation and possibly an upper endoscopy to assess the health of your esophagus and stomach lining.
All right, Doctor. Thank you for your guidance. I will start taking the medication as prescribed, and I will follow up with the gastroenterologist.
You are welcome, Mrs. Johnson. It's important to address these symptoms comprehensively to ensure your overall well-being. Please keep me updated on how you are feeling and any changes in your symptoms.
I will, Doctor. Thank you again for your thorough care.
It's my pleasure, Mrs. Johnson. Remember, I'm here to help you every step of the way. Take care, and I will see you at your follow-up appointment.
Take care, doctor. Goodbye.
Goodbye, Mrs. Johnson. Hello again, Mrs. Johnson. It's good to see you. How have you been since our last appointment?
Hello, doctor. I have been doing much better, thank you. The medication you prescribed for the acid reflux has been helping a lot. I have also seen the gastroenterologist, and they performed an upper endoscopy. The results showed some mild inflammation in my stomach lining, but nothing too serious.
I'm glad to hear that the medication has been effective and that the endoscopy did not reveal any major concerns. It sounds like we are on the right track in managing your gastrointestinal symptoms. Have you made any changes to your diet or lifestyle that have contributed to your improvement?
Yes, I have been following the dietary recommendations provided by the gastroenterologist, such as avoiding spicy and acidic foods, eating smaller meals more frequently, and not lying down immediately after eating. I have also been trying to manage my stress levels, which I think has helped as well.
That's fantastic to hear, Mrs. Johnson. It sounds like you have been proactive in implementing the recommended lifestyle changes, which can have a significant impact on managing gastrointestinal issues. I'm pleased to hear about your progress. Are there any other concerns or symptoms you would like to discuss today?
No, I think that covers everything for now, doctor. I just wanted to express my gratitude for your excellent care and support throughout this process.
It's my pleasure, Mrs. Johnson. Your health and well-being are always my priority, and I'm here to support you in any way I can. Please don't hesitate to reach out if you have any questions or if there are any changes in your symptoms.
Thank you, doctor. I appreciate your continued support. I will be sure to keep you updated on my progress.
Sounds good, Mrs. Johnson. Take care, and I will see you at your next follow-up appointment.
You too, doctor. Goodbye.
Goodbye, Mrs. Johnson. Good morning. How can I help you today?
Hi, doctor. I have been having some pretty bad stomach pain for the past few days, and it's not getting any better.
I'm sorry to hear that. Can you tell me more about the pain? When did it start, and how would you describe it?
It started about 4 days ago. It's a sharp pain, mostly on the lower right side of my abdomen, and it comes and goes. Sometimes it feels like a cramp, and other times it's more of a constant ache.
Have you noticed anything that triggers the pain or makes it worse?
Eating seems to make it worse sometimes, especially if I eat something heavy or greasy.
Any other symptoms along with the pain? Nausea, vomiting, fever, changes in bowel movements?
I have had a bit of nausea, but no vomiting. No fever either. My bowel movements have been a bit irregular, sometimes constipated, sometimes loose.
All right, given your symptoms, I am considering a few possibilities. One concern could be appendicitis, especially with the pain on your lower right side. Another possibility might be gastritis or a gastrointestinal infection. Have you had any recent changes in your diet or have you been under more stress than usual?
I have been pretty stressed lately, and I have been eating out more than usual.
Stress and diet changes can definitely impact your digestive system. I would like to do a physical examination to check for any signs of appendicitis or other abdominal issues. We might also need to run some tests like blood work or imaging to get a clearer picture.
Okay, that sounds good. I'm a bit worried about it being appendicitis.
It's good that you came in early. Appendicitis can worsen quickly if left untreated. If it is appendicitis, we will need to address it promptly. In the meantime, I will prescribe something to help manage the pain and nausea.
Thank you, doctor. I appreciate your help.
You are welcome. Let's get you started on the examination and tests. We will figure out what's going on and get you feeling better soon. The tests have confirmed that you have acute appendicitis. We will need to perform surgery to remove your appendix as soon as possible to prevent any complications.
All right, doctor. I trust your judgment. Let's go ahead with the surgery.
I will arrange everything. The procedure is routine, and you should recover well afterward. I will answer any questions you have before we proceed.
Thank you, doctor. I am glad we caught this early.
Me too. You did the right thing by coming in when you did. We will take good care of you. The surgery went well. Your appendix was removed successfully.
Thank you, doctor. I'm feeling much better now.
You will need to rest and take it easy for a while as you recover. I will provide instructions for your post-operative care.
Understood. I can't thank you enough for your help.
It's my pleasure. Remember to follow up with me if you have any concerns during your recovery.
I will. Thank you again, doctor. Hello again, doctor. It's been about a month since my surgery, and I wanted to give you an update. Overall, I have been feeling much better.
I'm glad to hear that. How has your recovery been going? Any lingering issues or new symptoms?
Recovery has been smoother than I expected. The pain from the surgery site has mostly subsided, and I have not experienced any new symptoms. However, I have noticed that my digestion is still a bit off. I am having some bloating and occasional discomfort after eating.
It's not unusual to experience digestive changes after abdominal surgery. Your body is still adjusting. Bloating and mild discomfort can be common during this phase of recovery. Have you made any changes to your diet since the surgery?
Not really. I have been trying to eat light and avoid heavy or greasy foods, but sometimes I still feel uneasy after meals.
It's good that you are mindful of your diet. Continue to focus on easily digestible foods like fruits, vegetables, and lean proteins. Also, make sure you are staying hydrated. Sometimes, post-surgery, the digestive system can be sensitive to certain foods. If the symptoms persist or worsen, we may need to investigate further.
Should I be concerned about these symptoms?
Not overly concerned at this point, especially if they are improving over time. However, if you develop severe pain, fever, or notice any other concerning symptoms, please let me know immediately. We can run some tests to ensure everything is healing as expected.
Understood. I will keep an eye on things and reach out if anything changes.
That sounds like a plan. Remember to listen to your body and give yourself plenty of time to recover fully. If you have any questions or concerns in the meantime, don't hesitate to get in touch.
Thank you, Doctor. I appreciate your ongoing support and guidance.
You are welcome. I am here to help. I am glad to see you progressing well, and I am confident that you will continue to improve with time.
Thanks again, Doctor. I will be in touch if I need anything.
Good morning. How can I help you today?
Good morning, Doctor. I have been feeling a bit concerned lately. I have been experiencing some discomfort in my abdomen, and I have heard about something called fatty liver. Could you tell me more about it?
Of course. Fatty liver, also known as hepatic steatosis, is a condition where excess fat builds up in your liver. It's becoming increasingly common, especially with rising rates of obesity and unhealthy diets. Is there anything specific you have noticed that's making you think it might be related to your symptoms?
Well, I have been feeling a dull pain on the right side of my abdomen, and sometimes I feel bloated after meals. I have also been told that I have high cholesterol levels.
Those are indeed some symptoms that can be associated with fatty liver. Other common symptoms include fatigue, weakness, and a general feeling of unwellness. Have you made any recent changes to your diet or lifestyle that might contribute to this condition?
I have to admit, my diet has not been the healthiest lately. I have been eating a lot of fast food and sugary snacks, and I have not been exercising as much as I should.
That could definitely be a factor. A diet high in processed foods, sugars, and unhealthy fats can contribute to the development of fatty liver. It's important to make some changes to your lifestyle to help manage this condition. Have you had any blood tests or imaging done recently that could give us more information?
Yes, I had some blood work done recently, and my doctor mentioned that my liver enzymes were elevated. They also did an ultrasound and mentioned that my liver appeared fatty.
Elevated liver enzymes and a fatty appearance on ultrasound are strong indicators of fatty liver disease. We will need to take some steps to address this. The good news is that fatty liver is often reversible with lifestyle changes. I would recommend starting by making some adjustments to your diet and increasing your physical activity. Cutting back on sugary foods and drinks, reducing your intake of processed foods and saturated fats, and incorporating more fruits, vegetables, and whole grains into your diet can all help.
That makes sense. I know I need to make some changes to improve my health. Are there any other treatments or medications that might help?
In addition to lifestyle changes, there are some medications and supplements that can be beneficial in managing fatty liver disease, especially if you have other risk factors such as diabetes or high cholesterol. However, it's important to discuss these options with your healthcare provider, as they can advise you on the best course of action based on your individual situation.
Thank you, doctor. I really appreciate your advice. I will start making those changes to my diet and lifestyle right away, and I will follow up with my healthcare provider to discuss any further steps.
You are welcome. Remember, taking control of your health now can have a significant impact on your future well-being. Don't hesitate to reach out if you have any questions or concerns along the way.
Thank you for your guidance, doctor. I have a few more questions if you don't mind. How quickly can I expect to see improvements in my condition once I start making these changes?
That's a great question. The timeline for improvement can vary from person to person depending on factors like the severity of the fatty liver, overall health, and adherence to lifestyle changes. In some cases, people may start to see improvements in liver enzyme levels and liver health within a few weeks to months of making dietary and lifestyle modifications. However, it's important to remember that this is a gradual process, and consistency is key.
That makes sense. I will be sure to stick to the recommended changes and stay patient with the process. Are there any specific types of physical activity that are especially beneficial for improving fatty liver?
Absolutely. Regular physical activity is crucial for managing fatty liver disease. Aerobic exercises such as walking, jogging, cycling, swimming, and dancing can help reduce liver fat and improve overall health. Aim for at least 30 minutes of moderate intensity aerobic activity on most days of the week, and try to incorporate strength training exercises at least 2 days a week to help build muscle mass and improve metabolism.
Got it. I will start incorporating more aerobic exercises and strength training into my routine. One last question. Are there any foods or supplements that I should specifically avoid or consider taking to help with fatty liver?
When it comes to dietary supplements, there is not strong evidence to support the use of specific supplements for fatty liver disease. However, some studies suggest that certain natural compounds like milk thistle, N-acetylcysteine, NS, and omega-3 fatty acids may have potential benefits for liver health. As for foods to avoid, it's best to limit or avoid foods high in added sugars,
refined carbohydrates, unhealthy fats, such as trans fats and saturated fats, and excessive alcohol consumption, as these can all contribute to liver fat accumulation and inflammation.
Thank you for clarifying that. I will be sure to focus on a balanced diet and consult with my healthcare provider before considering any supplements. I really appreciate your time and advice, doctor.
You are welcome. Remember, managing fatty liver disease is a journey, and I'm here to support you every step of the way. If you have any further questions or concerns, don't hesitate to reach out. Take care, and I look forward to seeing your progress at our follow-up appointment.
Thank you, doctor. I really appreciate your advice. I will start making those changes to my diet and lifestyle right away, and I will follow up with my healthcare provider to discuss any further steps.
That sounds like a great plan. It's important to take proactive steps to manage your health, and I'm glad to hear that you're committed to making positive changes. Along with dietary modifications and increased physical activity, it's also essential to monitor your progress regularly. We can schedule follow-up appointments to track your liver function tests and assess how your lifestyle changes are impacting your condition.
That sounds like a good idea. I will make sure to keep track of my progress and attend those follow-up appointments. Is there anything else I should be aware of, or any warning signs I should watch out for?
It's important to be mindful of any worsening symptoms or new developments. If you experience severe abdominal pain, jaundice, yellowing of the skin or eyes, swelling in your abdomen, or any other concerning symptoms, it's crucial to seek medical attention promptly. Additionally, it's essential to avoid alcohol consumption, as it can exacerbate fatty liver disease and contribute to liver damage.
Understood. I will be sure to pay attention to my body and seek help if I notice any concerning symptoms. Thank you again for your guidance, Doctor.
You are welcome. Remember, you're not alone in this journey. We are here to support you every step of the way. If you have any questions or need further assistance, don't hesitate to reach out.
Thank you, Doctor. I feel more informed and empowered to take control of my health now. I will be sure to follow your recommendations and stay on track.
That's great to hear. Together, we can work towards improving your health and managing this condition effectively. Don't hesitate to reach out if you need anything in the meantime. Take care, and I will see you at your follow-up appointment.
Thank you, Doctor. Take care as well, and see you soon.
Hello again. It's good to see you.
Hello, Doctor. It's nice to see you too.
How have you been feeling since we last spoke?
I have been feeling much better, thank you. I have been following your advice and making changes to my diet and lifestyle. I have been eating healthier foods, cutting back on sugary snacks and fast food, and I have been more active with regular exercise.
That's wonderful to hear. How have these changes been affecting your symptoms?
I have noticed a significant improvement in how I feel overall. The dull pain in my abdomen has diminished, and I don't feel as bloated after meals anymore. I have also been monitoring my weight, and I have noticed a gradual decrease, which is encouraging.
That's great progress. It sounds like your efforts are paying off. Have you noticed any changes in your energy levels or any other symptoms?
Yes, I have. I feel more energetic and less fatigued throughout the day. I have also been sleeping better, which I think is a result of both the dietary changes and the exercise.
That's fantastic to hear. It sounds like you're on the right track. Have you had any follow-up tests or appointments with your healthcare provider since our last visit?
Yes, I did. I had some blood work done, and my liver enzymes have improved compared to before. My healthcare provider also mentioned that my ultrasound showed less fat accumulation in my liver.
That's excellent news. It's great to hear that your liver health is improving. Your dedication to making positive changes to your lifestyle is truly commendable.
Thank you, Doctor. I'm really grateful for your guidance and support throughout this process. I feel motivated to continue with these healthy habits and keep working towards improving my overall health.
You are very welcome. I'm here to support you every step of the way. It's important to remember that managing fatty liver disease is an ongoing process, and your commitment to maintaining these lifestyle changes will be key to your long-term success.
I understand, and I'm determined to stay on track. Thank you again for all your help, Doctor.
You are welcome. Keep up the great work, and don't hesitate to reach out if you have any questions or concerns. We will schedule another follow-up appointment to monitor your progress and adjust your treatment plan as needed.
Sounds good. Thank you, Doctor. I will see you at the next appointment.
Take care, and I will see you soon. Good morning. How can I help you?
My daughter is a picky eater. I wonder if you could give me some advice on what I should do.
Okay, Mrs. Smith, I would like to ask some questions about your daughter. What's her name?
Her name is Kyla.
How old is she?
She just turned 3.
Why do you think she is a picky eater? Does she have any specific preference for food?
Yes, she only eats some potato chips, candies and fruits. She does not like to eat regular meals.
Does she often drink high-calorie drinks like juice, soda, or milk?
She only drinks milk and water.
When do you think she started behaving like this?
2 or 3 months ago.
She does that all the time?
Yes.
So you think it's getting worse?
Yes, I think it does.
Have you ever punished, bribed, or rewarded your daughter to alter her eating behavior?
No, doctor.
Do you usually follow a set schedule for meals?
Yes.
Do you usually give her any desserts with regular meals?
Sometimes.
Does she watch TV before mealtime?
Yes, she watches TV sometimes.
What kind of diet does she take? How many times does she eat in a day?
I began to include small pieces of fruits and meat in her diet. She eats 5 to 6 times a day.
Is there any reason you can think of why she is not willing to eat meat?
I am sorry, but I have no idea.
Did she have any experience of vomiting or diarrhea after eating meat in the past?
No, not at all.
Does she hate the smell or taste of meat?
Oh, I am not really sure about that.
How would you characterize your family's diet?
We eat meat and vegetables.
Does she have any symptoms like constipation, belly pain, bloating?
She has constipation.
How many times in a week does she have bowel movements?
2 to 3 times a week.
What is the stool like? Hard? Large? Dry? Painful to pass it?
It looks dry and hard.
May I know the color?
Light yellow.
Any blood in it?
No, I have not noticed any blood in it.
Have you ever noticed any bright red blood on the toilet paper?
I have not.
Does she usually sit on the toilet long? How long?
Not too long, probably just about 3 to 5 minutes.
Does she hold defecation when she plays?
No, she does not. I can say that because she feels uneasy and informs right away that she wants to go to the bathroom.
Does she resist toilet training?
Yes, sometimes.
Any urinary problems?
Not at all.
Any other symptoms? Fever? Headache? Cough? Shortness of breath?
No.
Did she ever have similar episodes before?
No.
Did she ever have health problems?
No.
Any hospitalizations?
No.
Any surgical operations?
No.
What about allergies?
She has no known allergies.
How many children do you have?
She is the only one.
Do you have any complications during your pregnancy or delivery?
No.
Was she healthy after the delivery?
Yes, she was.
Being her parent, how often do you spend time with her?
A few hours a day because we both have work.
Who takes care of her then?
She goes to the daycare.
What kind of house do you live?
Very old one.
Are her immunizations up to date?
Yes.
When was her last well-child checkup?
6 months ago, and everything went well that time.
Did she have any infections before?
No.
Did you just move here recently?
Yes, we just moved here 6 months ago. So is my daughter okay?
Based on what I have heard from you, I think that your daughter's not eating well as part of normal behavior of toddlers. It's pretty common in that age group. But even though the chances are low, there are some other possibilities of behavioral changes and constipation. So, I will run some tests to rule them out. Does this sound okay to you?
Yes, that sounds good.
For her eating problems, I would like to give you some hints to make it better. It can be helpful for you to follow a set of eating time. With this, she can naturally realize the mealtime and get ready. Also, it's better to cut down high-calorie drinks or snacks between meals. One more thing, eating environment is important sometimes. So it's better to block her from any possible distractions like TV. And for constipation, I would like to suggest that you give her high-fiber diet like cereals, fruits, and vegetables.
Yes, that sounds good.
So I would like you to take your daughter here soon.
Sure.
It was nice talking with you. Have a good day.
In today's video, we have compiled simple and relatable conversations that you might encounter in your daily life. These conversations are not only a great way to improve your English, but also to understand how English is spoken in real-life situations. So, whether you're a beginner or looking to brush up on your English skills, you're in the right place. Let's dive into these everyday English conversations and make learning fun. Please like, share, subscribe and hit the bell icon to get notifications of our new videos, and also comment.
Welcome to Learn English for Life.
Good morning, I am Dr. Emma. How can I help you today?
Good morning, doctor. I'm Mrs. White and I'm here because my daughter has diarrhea.
Oh, poor baby. It must be very hard for you too.
Yes, doctor.
I'm sorry to hear that, Mrs. White. May I have her name, please?
Her name is Mary.
What a nice name. And how old is she?
She's 9 months old.
She's still very young.
Yes, very young to suffer this illness.
Right? Can you tell me more about her condition?
Her stools were watery for 3 days now and defecates 3 to 4 times in a day. She very lethargic and does not eat well.
I see. Can you describe the stool? What's the color?
It's yellowish.
Is there blood on the stool? If so, is it fresh blood?
The stool has blood, but I don't know what a fresh blood looks like.
Okay. Any mucus?
No, doctor.
Have you taken her temperature?
Yes, but her temperature is just 36.5. That's normal, right?
Yes, her temperature is within the normal range. Was there a time that she was shaking?
No.
Where is she now? Is she staying with you?
Yes, she's with me.
Have you tried giving her medications?
No, I don't know what medication to give her.
Okay. Have you noticed any food that makes her diarrhea worse?
Few minutes after breastfeeding, she tends to defecate a lot.
I see. Any other symptoms that you have noticed?
No, doctor.
How often do you have to change her diapers?
Around 10 in a day.
Has she ever had any similar episodes before?
No, doctor.
Is she a full-term baby?
Yes, doctor.
Was she delivered vaginally or C-section?
Vaginally.
Did you have routine checkups during your pregnancy?
Yes, doctor.
Did you have medical problems during pregnancy or after birth?
No complications at all.
Are her immunizations up to date?
Yes.
Does she have regular checkup with her pediatrician?
Yes, doctor.
Who usually takes care of her?
My mother and I.
Can you tell me about her diet recently?
She's exclusively breastfed.
Has she ever traveled?
Not yet.
Mrs. White, I think your daughter has an infection in her bowels. For adults, it might not be a serious problem, but a baby as young as her has to be closely monitored. A baby's immune system is not fully developed yet, so they are prone to infection. We need to confine her to this hospital for close monitoring and for hydration. However, there may be other causes of the symptoms that she is manifesting right now. For us to rule out other possibilities and get the exact diagnosis, we need to do some tests.
What brought you here, Ellen?
I'm so sorry.
How long have you been coughing?
It's been 3 months already.
So it got worse recently.
Yes, doctor.
Do you notice some phlegm?
No,
Is the cough there all the time? Or it's on and off?
it's been here all the time.
Is there anything that makes your cough worse? Like positional changes, seasonal changes, after eating?
Positional changes like lying down makes me cough even worse.
Is there anything that makes your cough better? Have you taken any medication?
I took some cough medication.
So do you have any other symptoms besides a cough? Any fever? Chills? Night sweats?
I have had on and off fever.
Have you noticed any changes in your weight? Any changes in your appetite? Any changes in your bowel habits?
I have lost weight, though my appetite seemed normal and my bowel habits are regular.
Have you experienced shortness of breath? Have you felt any chest pain?
Yes, there were times when felt like I was catching my breath, and I also experienced chest pain sometimes.
Have you ever had wheezing? Headaches? Runny nose? Sore throat? Postnasal drip?
Yes, I have had postnasal drip.
Have you ever had asthma? Gastric acid problems? Allergic rhinitis? Drug allergies? Any heart problems?
No, I have not had any of those.
Do you have any other problems in your lungs? Stomach? Liver? Kidneys?
No, doctor.
Have you ever had any surgeries?
I never had one in my life.
Is there anybody in your family being sick now? What about at work?
Actually, I work at the day care center and the kids are always sick.
Do they have the same cough as you do? A cough without phlegm?
Some kids cough with phlegm, but some also have none.
Is there anybody who has had tuberculosis around you?
No, doctor.
Is there anybody in your family having other disease such as diabetes? Heart problems? High blood pressure?
My father has high blood pressure.
Now I would like to ask some personal questions which can be helpful for me to figure this out better. Is it okay with you?
No problem, doctor.
So how long have you worked in the daycare center?
About a year, doctor.
Do you drink? Do you smoke? Do you use any illegal drugs?
I drink occasionally, but I have not tried smoking and using illegal drugs.
Now, I would like to ask you about your sexual life. I know this is very private, but sometimes this can give us a big hint. Will you not mind?
Not at all. I am open for those questions as long as it can help figure out my problem.
Okay, are you sexually active? If so, how many partners do you have? Do you use protections?
No, doctor. I'm not sexually active.
Where are you originally from?
I'm from the Philippines.
Have you recently traveled? When is the last time you traveled outside of Los Angeles?
I went home to the Philippines 3 to 4 months ago.
Do you have any pets at home? Were you exposed to any animals or birds recently?
No.
Have you ever had PPD test? Like an injection on your arm and measure the round-in duration 2 days later?
Not yet, doctor.
Okay, thank you for answering my questions, Miss Ellen. Even though there are some more possible sources of your coughs, like asthma or pneumonia, I'm still not sure exactly what it is. So I will run some tests such as blood works and chest x-rays. I think I can talk to you better about the diagnosis and the proper treatment when I get the result of those tests. In the meantime, I will give you medication to ease your cough. Do you have any questions?
I work at a day care center. Is this the reason why I have a cough?
It might.
Do I need antibiotics to get better?
Maybe. It depends on what you really have though. If it is pneumonia, they help. But for others, they do not.
Okay, doctor. Thank you so much for your time.
Welcome. See you soon.
Good morning. How can I help you today?
Good morning, doctor. I have been having trouble with my memory lately. I forget things quite often, and it's starting to affect my daily life.
I see. Memory issues can be concerning, but there are several strategies we can explore to help improve your memory. First, let's talk about lifestyle factors. Are you getting enough sleep?
I think so, but maybe not consistently. I often stay up late working on projects or watching TV.
Adequate sleep is crucial for memory consolidation. Try to aim for 7 to 9 hours of quality sleep each night. Establishing a regular sleep schedule and creating a relaxing bedtime routine can help.
Okay, I will make an effort to prioritize sleep. What else can I do?
Regular physical exercise is also beneficial for memory. Exercise increases blood flow to the brain and promotes the growth of new brain cells. Aim for at least 30 minutes of moderate exercise most days of the week.
That sounds manageable. I will try to incorporate more physical activity into my routine. Are there any specific exercises or activities that are particularly good for memory?
Activities that engage both your body and mind are excellent for memory. Consider activities like brisk walking, swimming, or yoga. Additionally, mental exercises such as puzzles, crossword puzzles, and brain training games can help keep your mind sharp.
I will give those a try. What about nutrition? Are there any foods or supplements that can help with memory?
A healthy diet rich in fruits, vegetables, whole grains, and lean proteins provides essential nutrients for brain health. Foods high in omega-3 fatty acids, such as fatty fish, walnuts, and flax seeds, are particularly beneficial for memory. Additionally, certain supplements like omega-3 fatty acids, vitamin D, and antioxidants may support brain function, but it's essential to consult with a healthcare professional before starting any new supplements.
I will make sure to include more brain-healthy foods in my diet. Are there any other strategies I should consider?
Yes, practicing mindfulness and stress management techniques can also support memory. Chronic stress can impair memory function, so finding healthy ways to manage stress, such as meditation, deep breathing exercises, or hobbies you enjoy, can be helpful.
That makes sense. I will work on incorporating some stress relief techniques into my daily routine. Thank you for all the advice, Doctor. I feel more hopeful about improving my memory now.
You are welcome. Remember, making these lifestyle changes may take time, so be patient with yourself. If you continue to experience memory difficulties despite these efforts, don't hesitate to follow up with me so we can explore further options.
I appreciate your guidance, Doctor. I will definitely keep you updated on my progress and reach out if I need further assistance. Before I go, I have a few more questions about memory techniques.
Of course, I'm here to help. What would you like to know?
Well, I have heard about mnemonic devices as a memory aid. How effective are they, and how can I use them?
Mnemonic devices can be highly effective for improving memory, especially for remembering lists or sequences. They work by associating the information you want to remember with something more memorable or familiar. For example, you can use acronyms, visual imagery, or rhymes to help encode and retrieve information. Let's say you need to remember a list of items: apples, bananas, oranges, and grapes. You could create a mnemonic like a big orange gorilla, where each word corresponds to the first letter of the items in your list.
That sounds like a useful technique. I will try incorporating mnemonic devices into my daily life. Are there any other memory strategies I should know about?
Yes, another helpful technique is spaced repetition. This involves reviewing information at increasing intervals over time, which helps strengthen memory retention. Instead of cramming all your studying into one session, space out your study sessions and review the material regularly. You can use flashcards or online apps designed for spaced repetition to help facilitate this process.
That sounds like a more efficient way to study and retain information. I will give spaced repetition a try. Is there anything else I should keep in mind as I work on improving my memory?
One last important point is to stay mentally active and continuously challenge your brain. Engaging in activities that require cognitive effort, such as learning a new skill, playing musical instruments, or engaging in stimulating conversations, can help maintain and improve memory function as you age.
I will be sure to keep my mind active and seek out opportunities for mental stimulation. Thank you so much for all the valuable advice, Doctor. I feel much more equipped to tackle my memory issues now.
You are welcome. Remember, improving memory takes time and consistent effort, so don't get discouraged if you don't see immediate results. Stay committed to implementing these strategies, and I'm confident you will notice improvements over time. If you have any further questions or concerns, don't hesitate to reach out.
Thank you again, Doctor. I will be sure to follow up if needed. Have a great day.
You too. Take care, and best of luck on your journey to better memory health.
Before I go, I have one more question. I often find it challenging to remember names and faces, especially in social situations. Do you have any tips for improving this aspect of my memory?
Certainly. Difficulty remembering names and faces is common, but there are strategies you can use to improve this skill. One effective technique is to actively engage with the person you are meeting and try to associate their name with a distinctive feature or characteristic. For example, if you meet someone named Lisa who has blue eyes, you can mentally connect the name Lisa with the feature of her blue eyes.
That sounds like a practical approach. I will give it a try next time I meet someone new. Are there any other tips you can share?
Another helpful strategy is to repeat the person's name during the conversation and use it when addressing them. This repetition can reinforce the memory of their name. Additionally, try to pay close attention to facial features, unique characteristics, or any visual cues that can help you remember the person later.
I will make an effort to be more attentive and use these techniques when meeting new people. Thank you for the helpful advice, Doctor. I will be sure to put it into practice.
You are welcome. Remember, improving memory is a gradual process, so be patient with yourself as you work on implementing these strategies. If you have any further questions or need assistance, don't hesitate to reach out. Take care, and I wish you the best in improving your memory skills.
Thank you once again, Doctor. I appreciate your support and guidance. Take care and have a great day.
You too. Take care, and don't hesitate to reach out if you need anything. Goodbye.
Goodbye.